Good evening, everyone. Thank you so much for attendees here, both in person and virtually. We're here tonight to talk about Lake County's ADA Transition Plan project and have a public meeting here to welcome any discussion, feedback, questions. Hopefully we can provide some good answers for you. Just kind of some upfront information about the meeting format. Again, this is a hybrid event, so attendees both online and in person. We're starting off with a presentation. That'll be a maximum of 15 minutes, maybe a little bit shorter than that. And then we're going to have a Q&A session on any of the material from the presentation. Definitely want to be sure for any attendees online, you have an opportunity to ask and we'll answer any questions you all have. And then after the conclusion of the question and answer period, we have some online engagement tools that are available so that anyone who's attending virtually can also go on. We have a map and a survey that we'll describe, and you can add more input there. And then additionally, for anyone here in person, we have some materials in the room. We have some maps and some boards with areas of accessibility where we want to get your feedback and input on your thoughts and opinions about accessibility in Lake County. And so just kind of wanted to outline the format for everyone. But with that, kind of hopping into the presentation itself, going through our agenda here. Want to start off by introducing who we all are in the room and get to know you all a little bit as well, and then go through goals and objectives, some background on the Americans with Disabilities Act, what is an ADA transition plan and what's the purpose of it, and then get specific about work that Lake County has done in the past as they have been developing this transition plan over many years at this point. Walk through what was done previously, and then specifically what we're doing as part of this current ADA transition plan update project. And then also go through the public outreach, this event being a big part of it, but also, again, the online materials that I've mentioned, talk about the outreach that has been completed to date, and be sure you're aware of how to provide input here and online, and then, of course, questions and comments. So with that, first, wanted to give RuthAnne the opportunity to introduce herself.
Good evening. Thank you all for being here today. My name is RuthAnne Hall. I'm the Assistant County Administrator, and I also serve as the county's ADA Coordinator. And I want to thank everybody for attending here in person and also virtually. I know that Alex Carr from our communications is monitoring the chat. So if you do have questions, please make sure to enter those questions in the chat. And if they pertain to a particular slide, Alex can make sure to ask that question, or we'll hold questions until the end. I also wanted to take a moment to thank the county board for their investment and approval of the county's ADA transition plan, the project that we're working on here. The county contracted with Kimley Horn to develop the comprehensive ADA transition plan. And this work builds upon previous work that the county did in 2016 and 2018 in the review of public rights of way and our buildings. And in this comprehensive plan, we're also including a review of county services, our policies, practices, programs, and activities. A critical component of this transition plan is public input from yourselves. The meeting tonight provides an opportunity for those in person and online to ask questions about the process that we've undergone to develop the plan and provide feedback through the boards displayed in the room and through the online public access survey and mapping tool that we provided to people online. And then for those of you who would like to access that, it'll be open for a period of a couple weeks. So at this point, again, thank you so much for coming. I'm gonna turn over our presentation to our consultant team at Kimley Horn.
Thank you, RuthAnne. And then, as she mentioned, I'm Matt Poole with Kimley Horn, serving as a deputy project manager on this project. My background is in transportation engineering, but I've been working on accessibility related projects and ADA transition plans for almost 13 years now. And then Peter Storr.
I am the project manager for this project. I work out of our Deerfield office in Lake County.
And we also had a couple other partners. DLZ National is a national architecture engineering firm, but they have a group who specializes in accessibility as well. And then Deep Walk is a company actually based out of Illinois, Chicago area, who specializes in public rights of way data collection through the use of LiDAR technology. using mobile phone to collect sidewalk condition information. So we'll talk more about that process a little bit later on in the presentation. But just to set the stage, the goals and objectives for this project, again, this is the county's ADA self-evaluation and transition plan. So kind of looking at the, we've got a sentence there that this project results in a master plan, the development of a countywide master plan for accessibility. And so as part of that, the main goal, of course, is to improve accessibility for all citizens, get participation from both the public, but in particularly focus on members of the disability and the disabled community, as you know, those are the people who are most impacted by the improvements that will come out of this project. We want to be sure that county staff is educated on the requirements of the ADA and also develop a comprehensive list of accessibility barriers. And so we'll use that term a lot and help define what a barrier to access is. But there are 5 titles to the ADA, focusing on different areas, but specifically for the ADA transition plan, it's a requirement for state and local government entities under Title II of the ADA. And that really, again, focuses on how those government agencies interact with the public. And so anything that the agency offers to the public needs to be available and accessible to all members without any discrimination based on level of ability. And so, as I just said, the basic requirement for those Title II agencies is that we must ensure that individuals with disabilities are not excluded from any programs, services, or activities offered by the county. And pedestrian facilities are an example of a program. Really, any physical facilities are an example of a program. And so we'll talk about what program means in this context, but also we'll have a lot of focus on the physical facilities that the county offers. And the photos here are showing examples of barriers to access. We have, you know, an example where someone using a powered chair is at the base of a set of stairs and they're unable to get into the building at the top. And so that's a pretty clear example of a barrier. They're not able to participate for activities inside of that building because they can't get in because there is a set of stairs in front. And so the transition plan itself, the main requirements are that we identify any obstacles that limit the accessibility of programs or activities. And again, this is really anything that the county offers to the public. Physical facilities will have physical barriers, and this would include locations such as sidewalk corridors, public rights of way being sidewalk that runs along the side of a roadway, as well as any pedestrian street crossings or signalized intersections where there's push buttons to cross the street. There are requirements for all of those under the ADA. And then programmatic barriers are really more communication-based or things that are offered, for instance, on the county's website or events like this. If someone needed an accommodation, how would they request that accommodation? Those are all examples of programmatic elements where there are requirements for accessibility. And so after identifying any of those barriers, we form a long-range plan where we specify a yearly schedule for implementing accessibility improvements. And also, as a big part of the plan, there are some administrative requirements. And the first of those is to identify a county employee who's called the ADA coordinator. And their job is, as RuthAnne just described earlier, to coordinate compliance with disability or non-discrimination laws. They're the center point of contact both internally for county staff and coordinating with the various departments for accessibility, as well as externally for members of the public. If they have questions, concerns related to accessibility, they would contact the ADA coordinator, who is RuthAnne. So we have her contact information here. It's also available on the county's website. And of course, she's here for any questions this evening. A couple other administrative requirements that are part of the plan is first providing what's called public notice or an acknowledgement that the county is aware of their responsibilities to the public under the ADA and that they're working to meet those responsibilities. And so this information was previously developed, but it was reviewed as part of this plan and updated, and that's available on the county's website. This information can be provided in multiple formats if needed. If someone would like to have the information outside of the website, it does include RuthAnne's contact information as well. And then the third administrative requirement is the development of a formal grievance procedure. And again, the county already had one of these in place from previous efforts, but it's been reviewed and updated. And this is a means for anyone who has a concern or grievance related specifically to accessibility. It's kind of a formal process for that grievance to be made, and it includes information such as timeframes in which the county needs to respond, an appeals process, and things of that nature. And so all that information is up to date, current, and on the county's website. And then we've mentioned a couple of times the previous efforts to date. So in 2016 was the development of the county's original ADA transition plan, which focused really heavily on some evaluations for county-owned building facilities. It didn't cover all of the buildings at that time, but the vast majority of those that were open and able to be used by the public. And then in 2018, that was supplemented with the inclusion of a review of all of the county's curb ramps, which for anyone who can see the maps in the room, there's a very large area covered by the county roadways. And so many curb ramps were evaluated and included in that study. And then now with this 2025 update, we're supplementing all that effort through a schedule shown here. And so just kind of wanted to show the schedule and outline the major tasks, and then we'll quickly talk about each of them. But we kicked things off towards the end of last year, and then throughout this year and into early 2026, have worked on a variety of tasks, including reviewing and updating some of the existing information from the previous studies, doing additional evaluations of both the public rights of way, sidewalk corridors, building spot checks, and then a review of all of the county's programs. And now we're in the process of bringing that information together into the transition plan. And we'll be developing that towards the end of the year as we present it to county staff for eventual approval. And throughout this process, there's been a couple opportunities for public input. We'll talk more about those. This is just being kind of the second major public input effort. But as part of the existing review of plans from 2016 and 2018, one, just wanted to be sure we documented all of that as part of this update, what was done at that point in time, but also wanted to get a feel for anything that might need to be looked at again, given it's been almost 10 years since the 2016 study. And so we did do some spot checking of the previous building evaluations and made sure those were comprehensive, and have summarized our findings from those and incorporated that into this transition plan update. One thing that was new for this update is a review of the county's programmatic elements, or in more detail, it's services, policies, practices, programs, and activities. So all kinds of different things that the county may offer. Each of those terms has kind of a different meaning under the ADA, but in short, we'll call it a programmatic review. And really, again, wanting to understand what's on the county's website, how events like this or others are administered, how someone who needs an accommodation might need to request that, and provide the county with guidance on any communication or digital updates they may need to make. Again, they're proactively making updates all the time to their website, and we'll talk more about that. But some of the information that needs to be available online is shown here. Any PDFs or information for how members of the public can participate in events, all that needs to be available online in such a way that it's available to all. It's able to be read by a screen reader. And so that's kind of the nature of the programmatic review. Switching gears to physical facilities, we've also included, again, as part of this study, a review of all of the county's sidewalk corridors. And this includes everything besides the curb ramps, which were done previously. And so pedestrian street crossings through intersections, over 1,000 different intersections. There was a couple on-street parking locations that we've reviewed for ADA compliance, 95 miles of county sidewalks, and then 89 signalized intersections. So many physical facilities. These are reviewed using the latest accessibility guidelines, which are the 2023 PROAG, Public Rights of Way Accessibility Guidelines. And this work was all done using GIS-based data collection. We are out there, boots on the ground in the field, actually recording conditions. I mentioned the Deep Walk partner who has a mobile application for scanning sidewalk, and then we've supplemented that with any additional measurements at the parking areas, for example, or pedestrian signalized intersections, pedestrian equipment at signalized intersections, There are photos of the current conditions as well as detailed measurements which help us determine the ADA compliance. Just to give a feel for the types of barriers and the ADA compliance elements that we are looking to identify. For buildings, it's kind of everything from getting parked at the building and then getting in to a facility. For parking, accessible parking spaces are supposed to have access aisles, there's signage requirements, they need to connect to an accessible route. So this left image doesn't have much of any of those things going on. At any entries or doorways, there's a threshold requirement of 1/4 inch or less for entry. It's the same on a sidewalk corridor. We all understand that there's many instances where that probably isn't the case due to settling or due to instances here where at a door there's a threshold that's too high. Transaction counters, there should be a lower counter so that maybe a wheelchair user or someone who is able to interact at the appropriate height and not looking up to someone who they're transacting with. And so this example doesn't have that lowered counter area. And then in restrooms, there's many requirements, but an example here of a sink not having the proper knee or toe clearance, so that underneath the sink there should be a clear area that's unobstructed. And similarly, there's height requirements for the sink. These are just some examples of the types of things that we're identifying, but they're pretty common to see these types of issues, so we wanted to share them with you.
Not Lake County photos.
Thank you, RuthAnne. Yes, these are examples, to be clear, everyone, not Lake County examples, but just general examples. We do have all of the data that we're collecting and processing for the Lake County specifics. For sidewalks, pretty easy to see between, we have 2 images on the left with clear, open, flat sidewalk that has no barriers, no elevation changes. There is a pole in the second image, but there's a wealth of maneuvering clearance around that pole, plenty of clear width. And then on the right, we have broken up, shattered sidewalk, which would be very difficult for anyone using a mobility device to traverse, let alone anyone in general. And same on the right, just a big broken piece of pavement, big slopes, very difficult corridors to traverse. When we're talking about signalized intersections or curb ramps, again, having detectable warning surfaces, you may have seen the red domes at intersection crossings at curb ramps. Those are actually required, and they would alert someone with low or no vision that they're entering a vehicular area. Having push buttons that are adjacent to the paved surface, rather than on the right, having broken concrete, again, as someone transitions from a curb ramp into the street, or having push buttons at a signalized intersection where they're in the grass and someone who may use a wheelchair or a walker or other device is going to have a lot of trouble traversing that grassy area to get to the button. And so just wanted to share some of those for the physical facilities. Similarly, for the programmatic barriers, wanted to highlight some of the updates and work that the county has been doing. You may have noticed some of these changes recently, but examples of how we aim to achieve programmatic accessibility. One example is on any videos for board meetings or similar types of meetings. There's now captioning that's provided. And so that, again, provides just another way that someone who may have low hearing or no hearing is able to receive the information. And similarly for the website in general, it's undergone a major update to meet all of the digital web requirements, which are WCAG. And so just wanted to kind of highlight that is all in place, ongoing, and a lot of great work has been done recently. So after collecting all the information on barriers, we developed a comprehensive plan for improvements, as was mentioned. We want to prioritize those improvements through a number of different factors, and then develop the cost to bring everything into compliance, and also a schedule associated with that, really based on the volume of barriers and the estimated cost of improvements. Comparing that with the county's budget and what is realistic to spend each year will help determine some of that implementation schedule. But to be clear, this is a long-range plan. It will occur over many years, and that's consistent with almost every community in the United States. These are long-range, multi-year plans. So that's a lot of the background on what the plan itself is, but a big component is getting input and understanding where members of the public, yourselves here in person and online, might have questions or challenges related to accessibility. And so this project includes a public outreach initiative. We want to, of course, introduce the project, which we've done a lot of here today, and then gather input to help help provide another layer as we look towards making those improvements. And so there are two key initiatives. One, of course, we described a little bit, but we have some online tools, a survey that's been administered through the county's website and was also described on social media. We try to get the word out quite a bit, but that information is available, a survey and a mapping tool, two different tools that both aim to get a similar input, but the mapping allows you to identify specific areas of question or concern. We opened that feedback for feedback in May, and now has been reopened here kind of in September and through early October to get any final feedback. But then, of course, everyone attending tonight, we want to get your questions and understand any thoughts or comments you all have. And so we have, again, the online survey. There is a QR code and a link available for anyone who wants to scan, and we can make these available after the meeting as well. But just some brief statistics on where we're at. 152 respondents have already completed the survey. Some just high level information about, that we asked as one of the questions were what facilities do you use most? And that may help, again, inform the county of where they want to make some improvements. And so the court administrative complex was the most visited facility by 44% of respondents, or sorry, 44% of respondents said that was one of the facilities they visited most. 37% said central permit facility, and 14% said the health department and community health center, which all make a lot of sense. A lot of interaction there with members of the public in the county. There's a screenshot there of the survey. And again, we have a link and a QR code available. Similarly for the map, 53 visits to the map and 19 points of feedback received. Most commonly, people are entering areas where they want to see improved sidewalk or add crosswalks. But these tools are available, and we would encourage anyone to, now or later, to go online through October 3rd and provide any input if you haven't yet. And now getting kind of close to the end is where we really want to get everyone's input here tonight. Any questions or your concerns? How do you think the county is doing? Where would you like to see improvements? Any high priority areas? And not just physical facilities, but again, the website as well, or programmatic elements. And RuthAnne, again, is our key point of contact for the project. But with that, that was the end of our presentation.